Well, good afternoon, ladies and gentlemen. Welcome to the 14th in a series of unexpected conversations sponsored by the Center for Innovation. I'm pleased that you're able to join us today. It's a particular personal privilege to introduce to you Dr. Folkert Kuipers, who is a professor of pediatrics and the chair of the Healthy Living Alliance in Groningen, the Netherlands. I should say the northeastern Netherlands, to be precise. Last year was, for me, a great privilege to visit this part of the Netherlands. And in visiting with Folkert this morning, I've learned even more about the location. I know now that he actually was born and grew up in a very small but beautiful town of Pingedam, where I had the privilege to sit with local leaders and others talking about the future of healthcare in the northeastern Netherlands. Folkert is a remarkable gentleman. He studied biochemistry and ultimately pursued his doctorate studies at the University of Groningen and joined the faculty there, and actually has served in important leadership positions in Groningen. He was the Dean of the Faculty of Medical Sciences for 8 years, also served on the board of directors of the Groningen University Medical Center, and was part of the leadership team that brought those two organizations together. His areas of research have been in lipid metabolism and cholesterol metabolism, as well as liver disease. But in a remarkable capacity, he has gone from that basic science research to communities and thinking about everything from young cells and young people to older people, communities, the process of aging, and will bring to us some perspectives that are quite unusual, ones that we generally don't tend to think about in the United States. And it's one of the reasons that I'm very anxious to hear what he has to say today. He has actually been a leader in putting together multinational and international research collaborations and has other important roles in managing the research community and infrastructure in the Netherlands. He serves on the External Advisory Council at the Pasteur Institute in France, and I'm pleased that he has joined the Scientific Advisory Board for the Well Living Laboratory here at Mayo Clinic. The Well Living Laboratory, of course, being a collaboration between Delos Living and Mayo Clinic, a way that we can explore the impact of the built environment on human function, including human behavior. An endeavor that is just beginning and I think holds great promise. And so for us, it's really a great treat that we could attract Folkert to work with us and help us in guiding the way that we think about research in that environment and helping us to ensure the success of the research endeavor. So Folkert, thank you for that too. I'm really anxious and looking forward to what he has to say. Going from the bench to the bedside and beyond, there are many topics that we've had a chance to talk about this morning, and I know you will find him to be an engaging and provocative speaker. So Folkert, welcome to the Center for Innovation in the Mayo Clinic. We're pleased to have you. It's all yours.
Dr. Wood, thank you very much. It's indeed a great pleasure and privilege to be here again, but now today in the Center for Innovation and this afternoon in the Well Living Laboratory. So I've had already a very brilliant morning, and I'm pretty sure this afternoon will be exciting again. So it's also nice to be back here in Mayo to see all of you. So I was here in May last year, when I just stepped down as a dean for what I call a nano sabbatical. Actually, it was only 2 weeks. But then I was here in my role as a professor of pediatrics, so I spoke a little bit about lipids and nuclear receptors and that kind of stuff. And today I will talk about my other job, which is, let's say, the holder of the Healthy Life Alliance chair at the University of Groningen, which is indeed involved with the healthy aging program that we are running in the northern part of the Netherlands. So this is, in that sense, it's not a scientific talk, but it's more, let's say, a societal talk. The things we are doing, the things, how they are aligned to the things that you are doing here, because I think it's, for me, or at least in the last 8 years, I've spent a lot of time here also talking to Nick and to other people here, and to Dr. Wood, and also it's been very inspiring for me also to see how you can learn from each other to bring things forward. So what I thought I would do, because In the end, what we would like to have is a little bit of discussion this morning, also with Nathan, Dr. Wood. Would give you a short introduction of the things we are doing, which is very fragmented because I cannot tell you everything, but only give some snapshots here and there. So if you have questions in the meantime, please ask them directly. And after the talk, I try to do it 20 minutes. There will be time, but that's the thing. If you've been a dean, you talk forever, and you learn how to talk forever. Don't give answers, just keep talking. That's what they learn you as. But now in my new role again, I have to learn to talk less and do more. So just, I think it's always good to have a little bit impression. And so where I am is at the University of Groningen, which is one of the oldest universities in the Netherlands. So we're now in our 403rd academic year. So 3 years ago we had a big party. And so the University of Groningen is doing pretty well. So in the Shanghai ranking, which is let's say the global ranking of universities, we are currently number 72, which is pretty good for a university in a city of 200,000 people, I would say. And connected to the University of Groningen is the University Medical Center, which is actually a merger of the academic hospital and the Faculty of Medical Sciences, which was actually done effectively in 2005. So that's rather young still, and we are actually in the middle of the city. Many of you have been there already and know the place. So we call ourselves Healthy Aging Campus Netherlands. And also we call ourselves the smartest kilometer in the Netherlands, which not everybody agrees upon in the Netherlands, but we think it's really true. So this is where I am. And the University of Groningen is the only university actually who has a focus on societal issues. And the 4 societal themes that the university carries as a whole, and the first one is healthy aging, which we started at the medical center, but also energy transition, and I will show you in a minute why we think energy transition is an important thing. Sustainable society and big data management, these are the 4 societal challenges that the university is focusing on in all its faculties. So healthy aging, and I want to stress that healthy aging is not a medical thing alone. Healthy aging is a societal issue. So in our university, but also in our region, there's many different groups of people working on issues related to healthy aging. So for instance, our Faculty of Economics and Business has a large healthy aging program related to the financial issues of an aging population. In our sociology faculty, they have large programs on teaching health literacy, how to learn to behave in a healthy way, what are the best means to do that. And even in our Faculty of Religion Sciences, they have programs on healthy aging, how they should fit religion into healthy aging. So this is the university. We are in Groningen, and I can imagine that not everybody realizes where this beautiful city is. So we are so this is the Netherlands. No, the pointer doesn't work very well. Small country related to the States. We are in the north, and the University Medical Center, so the University of Groningen actually is the only university that's far away from the rest of the Netherlands, and it's only 200 kilometers from Amsterdam, by the way, but still it's a separate entity, and we serve, as a medical center, we serve about 2 million people for complex care in the northern part of the Netherlands. Groningen is a beautiful city. Well, Dr. Wood knows. This is the Martini Tower. We call ourselves also the city of talent, so we have a lot of talents. Epke is one of our students. He was a gold medalist in the Olympics. Swimming, Arjen Robben, of course, soccer player, although we don't do that well today. But the last year, of course, we had the real big talent, was Ben Veringa, who won the Nobel Prize for Chemistry. And actually, Ben is really from Groningen. He is not bored or something. He studied, he did his Ph.D, and he became professor in Groningen, and he won the Nobel Prize. So this is really a Groningen Nobel Prize. So next year we will be even higher on the Shanghai ranking. So this is the City of Talent. Again, medical center. As I said before, and I discussed this morning with the Center for Innovation, why I focus on healthy aging as a medical center. Well, as I said before, we only founded as a medical center in 2005, and we were looking for common theme. We're discussing would we be the center of chronic diseases or something like that, which we all thought was a very depressive kind of name, to be a center of disease. So we thought it would be better to be center of health. And because we are in a healthy and aging environment, we thought, well, let's focus on healthy aging as a theme. So what we have is actually the second largest medical center for complex care, especially in the north. So it's not compared to Mayo Clinic, but in the Netherlands it's pretty big. We have a lot of students in medicine, dentistry, and human movement sciences. We have a large research program, Graduate School for Medical Sciences, about 900 Ph.D. students. And on our campus we also have a healthy aging campus on which about 60 companies, smaller ones, bigger ones, big companies with, let's say, offices at our premises, R&D hotel, investment strategies. So also the economic impact is on our premises. So why focus on healthy aging? Well, you can see from this picture. So this picture is showing the prevalence in the Netherlands of cardiovascular diseases, overweight, chronic diseases in general, diabetes. We can add a list, cancer, everything. And you can see especially in the northern part of the Netherlands, this is Groningen. So we see overrepresentation all these diseases, especially on the borders of Netherlands, but also very strongly in the northern part of the Netherlands. It has to do with the socioeconomic status, but I will explain that a little bit later. But this is really was for us the key, because these are our patients, and they come to us at some point in time. And many of them, because we have an aging population, because this is actually the challenge. In fact, actually, life expectancy in our region is lower than in the rest of the Netherlands, which, of course, is not very nice if this is your region. Population is rapidly aging because young people move away, old people stay, and they get older. So it's double aging, actually. There's many age-related chronic diseases. Of course, not only in Groningen, but also in other parts of the Netherlands. But because of our population build-up, there's more. And of course, the problems related to healthcare provisions will be at stake at some point, because there's not enough young people to give all the care to the old people. So these are the challenges that we face, and that's why we chose for healthy aging as a overarching theme. And again, you can see this is not only medical, this is societal. And also, as explained this morning, our view on healthy aging is very simple. First thing, it's not about old people. In the end, it's old people, but it starts very early, and that's why the pediatrics come in. I always say healthy aging starts at conception or even before conception, so that's really a life course perspective. And what we want to do actually is to change the line, the dotted line, which is the normal, let's say the well-being line, from the dotted one to the striped one. So basically going from this to this, reduced burden of disease at the end of life, which will give a lot of societal gain, not only for the people themselves, because they are able to participate in society for a much longer period of time, they have a higher degree of well-being, but also for society itself, because it will reduce healthcare costs. So this is a very simple scheme that we often use, which also means that in contrast to the older times when we are focusing on intervention, that much more has to be done on prevention, primary prevention, secondary prevention, tertiary prevention, and that also that we have to teach our students, and because they are the doctors of the future, that they have to have more focus on prevention than on disease treatment. So this is a very simple picture. More years, better lives, which by coincidence, but not totally coincidence, also is fully in line with the European funding scheme Horizon 2020, which actually has a focus on 2 more healthy years for every EU citizen in 2020, which will not happen, but that was the ambition. So our program was fully in line with the European funding schemes, which also paid off very well because we had a choice very early on. So for science it was very good actually. So this is the focus. So how did we do it? So we did quite a lot of things, and this was, let's say, my dean stuff. So organize the research infrastructure to do, let's say, for the medical part and the scientific part. We did quite a lot of things, actually. So we made European Research Institute, completely new building, and many of you were at the opening, actually, in 2013. It's very basic science on aging, which lines up with the Folkert Center very nicely, and there's a lot of interaction. Mouse clinic, so we have a lot of mouse models. The system biology, Centers for Translational Research. A very important thing for us is Lifelines, which is a population cohort study in which almost 170,000 people will be followed for 30 years in 3 generations. So proben the parents' children. They are now in the second, it's almost 9 years running now, so it goes very well. And it's very good to imagine that on a population of 2 million, if you have almost 200,000, so 10% of the population is in Lifeline. So it's a study of Northern Netherlands. People feel proud of it. If there's something coming out in good journals, we put it in the regional newspapers, everybody's proud. So this is really a fundament for our healthy aging program. Also a lot of EU networks on aging. We are very proud of the Alliance for Healthy Aging already since 2008, which we funded through the Nobel Foundation. Nick was there, a lot of people were involved. It's running very nicely. We have annual meetings, so the next one will be in November in Groningen, and that's already the 8th joint annual meeting between Groningen and Mayo Clinic, so that's really running very well. We have a healthy aging campus, and of course a healthy aging network, and that's today mainly the topic, how we organize, let's say, not only the medical part, but also the societal part. And that's why we also in 2008, 2009 organized a triple helix organization called Healthy Aging Network Northern Netherlands, in which not only the Knowledge Institute, so University Medical Center, all the University of Applied Sciences in the northern part of the Netherlands, but also the schools for education of care professionals, all these organizations, and with the local businesses, large business, small businesses, into one network organization. And this is actually HAN, because we want to have societal impact of our research. So the research is very nice, and 4 days in the week, I think, well, it's research. 1 day in the week, I think, well, we have to bring it to society. And we have a lot of things, and there's a lot of possibilities, of course, because also in healthy aging, if you do it right, if you get new projects, if you have new applications, you should bring it as soon as possible also to the people who need it. And there's a lot of initiatives, and this is only a snapshot again. And Center for Innovation here has also developed a lot of things. Individual people develop apps, they develop all kind of issues. So we have our geriatrician organized this hospital at home program, which is a very nice program. Keep elderly at home as long as possible. We do a lot of stuff on health education, not only we, but also our other faculties. Health literacy, and let children and their parents healthy behaviors. Embrace is a very nice program we do with the other care institutions, in which there's a very personalized way of organizing the care for elderly people in villages. It works very nice, and it's also very cost effective, and they showed actually that it's very cost effective. So now actually the insurance company will also contribute to this program, to run it further. And of course there's the normal valorization, e-health applications. So this you can see, the ice skating game is very popular in the elderly in the northern part of the Netherlands. I don't know if it would work here, but they like to skate, and so they're skating and doing a lot of movements. Other issues, a lot of imaging stuff with Siemens. So we have to organize this in a proper way, and this is why we organized actually 2 things. One, and it actually was also what I saw here, so Center for Development Innovation, but in our place it's more for economic impact. So it realizes economic impact of the things we do. And more for the societal things, we have this triple helix organization called Healthy Aging Network Northern Netherlands. And they do all the organization also towards Europe, towards Brussels. And actually they do it very well. Well, they have a very beautiful website on which all these activities are localized. And importantly to know is that, and that's on the upper front, Already in 2013 and again in 2016, we were chosen as the region of excellence for healthy aging applications in Europe. So we have a 4-star region from the European Innovation Partnership on Active and Healthy Aging, which is linked to this funding program. So it's very important to have this 4-star region status, because it's also translates into funding for not for science, but really for applications. So that's very nice to have, actually. So this is Han, and they do beautiful things. So of course there's a lot of opportunities. Well, they do a lot on concept of care close to home. I mentioned just a few of them: e-health, embrace, a lot of these things they are organizing. Healthy lifestyle, also in combination with the dairy industry in northern part of the Netherlands and the food industry, because they really focus on healthy food at the moment, but also this health literacy programs that we are running with school children. Actually, our local soccer club is involved. They are the ambassadors, so they go to the schools to, well, if you want to become a soccer player, you have to eat healthy and all these kinds of things. Support active and social communities, and they can evaluate everything through lifelines. And another aspect, of course, is innovative housing, because as we'll discuss this afternoon again, in the Well Living Lab, we spend a lot of time in the house, so the house should be healthy. There's a lot of innovation to be done there, not only on the atmosphere in the house, but also, let's say, the life course proof housing, because people have to live longer in their houses. So it should be intergenerational, actually, with all the modern techniques. There's a lot of things to be done. And especially here, there's a lot of opportunities, because apart from our aging society, we have another big challenge which we have to translate into opportunity, and this is the fact that actually the northern part of the Netherlands is suffering from earthquakes, and I'm pretty sure that you, well, only the girl just spoke from Amsterdam probably knows it, but there's actually, in the northern part of the Netherlands, there's quite a lot of damage due to the pumping of natural gas, which is also probably some regions here in the States. But unfortunately for us, it's especially the province of Groningen that suffers. And this is actually an overview of recent earthquakes, and then the light blue ones are the light ones, which is 1 on the Richter scale, which is a very small one, of course, but if you have a lot of small ones, in the end it's a big one, and some of them are pretty big, actually. So this, and the arrow actually is, and that's where my interest comes from, that's where Appingedam is, where my parents still live, so I'm personally involved. That's also a disclosure, because when I get angry, I'll say, well, it's my stuff, so I'm allowed to be angry. But it's really a big impact, because this is really a challenge for the region, but also opportunity, because this also gives us a chance to do the things I want to do. Because, again, it was long denied, but really it really is serious shit, so to say. It really is a lot of damage, and actually what they, in the end, even they get Groningen people mad, really mad, and that's really a thing, achievement, so to say, to get Groningen people so mad that old people go on the streets to protest. And actually we had, 2 weeks ago we had elections in the Netherlands, and actually all the parties in the Netherlands, we don't have 2, we have 28 that are on the list you can vote on, and 14 of them will be in the parliament, and every individual party had a paragraph on Groningen compensation. So this is, again, it's a big challenge, because it's a societal, well, big problem. Not everywhere as heavy as here, but it's a problem. And we decided to, in combination with our healthy aging program, to use this actually as a new handle to get the things that we want. And we actually formulated a new ambition, I think a real bold ambition, and that's to turn the Northern Netherlands into the first man-made blue zone, and I'm pretty sure that most of you will know what the blue zone is. So blue zone, there's a couple of them in the world. It's a region where people, for some reason, become older in a healthy way. And the reason is probably partly genetic, but mainly it's societal, it's nutritional, it's societal context, is the, let's say, the feeling of being needed to have a network. And that's actually not at all the case in Groningen, of course, you notice that. Actually, we are currently, I would say, a red zone, but we want to turn into blue zone. So this is also what we put quite heavily on the agenda, on the political agenda. And although most politicians don't really know what we mean, but if we start saying blue now, they know what we mean. And this is where the money has to come from. And there's a lot of small initiatives, and so I will go through just to part of them, and we all hang them under the umbrella man-made blue zone. So one, Groningen will become smoke-free city. Actually, this is run by the new mayor of Groningen. You met him. He's very dedicated. He wants to make Groningen a smoke-free city, like New York kind of thing. And again, you see a lot of partners involved, and they all will participate. Again, this is, you can say this is a small initiative, but if you add up all these initiatives, in the end, we will have a blue zone. And you have to, as we discussed this morning, you have also to give the people the success. And this is not me, this is not the medical center, this is the people of Groningen. And the same is for instance, for this one. In the Netherlands, every boy and every girl at the moment, at some point in their life, plays soccer, and they play it in clubs. This is a very important societal thing, the soccer club. Now in the northern part of the Netherlands, all the soccer clubs want to become the healthiest soccer club. So the canteens will not sell sweets anymore. They will not get these power drinks before the game. They will get healthy stuff. Velocitas, which is a soccer club, one of the oldest in the Netherlands, they will want to be the first completely smoke-free soccer club. Members will also across the fields. So all these kind of initiatives will collaborate, will contribute. This one, intergenerational care institution. Actually, there's in Groningen, there's now two. So we have a lot of students in Groningen, so there's 200,000 people plus 50,000 students. So this is 1 in 5 is a student. Housing for students is, well, it's not that expensive, but still it's expensive. Students can live for free, but you have to spend 30 hours on social interactions with the inhabitants of these institutions. It's still running, I don't know how it works. Also takes probably a special kind of student, somebody who doesn't like to party in his own room, because that will not work very well, but at least this is one that fits. This is another one, actually will run next week. So there's every year there's a very, well, important, what's important, but cycling tour for ladies. Well, the Olympic champions and the world champion will be here, but this will now be the Healthy Aging Tour. And in every Finnish place, there will be a lot of activities for children. So they will get information about the food behavior by the Olympic champion of bicycling. There will be there will be meetings for the entrepreneurs of the village, how they can get themselves into these initiatives. And there will be also information about the housing stuff that we had just discussed. So this will really be the Healthy Aging Tour, which will last a week. We have a Healthy Aging Week, in which all the public is informed about all the things that are happening, and also mainly focusing on that it's their thing. It's not our thing, it's their thing. It's a thing of us together. And the focus, we always have one focus, and this focus will be on non-smoking next generation, but also to explain why it is. So these are all things that fit under this umbrella. We also do our own employees, of course. So we have programs for healthy aging at work. We have a website in which people are informed about the things we are doing. We have our own healthy aging journal. This is an old one with the old dean. there's a new one with a new dean, of course. All these things, we say, well, we have 12,000 people working at the University Medical Center, and they are our ambassadors. So they should, when they have a birthday party, tell about the things we are doing. And then, of course, there's also a much bigger program. So this is also a very nice one. And in this case, it's very nice to be at the border, because in EU you have special funding schemes for border regions. So this is a very successful one on hygiene in medical care institutions, hospitals, and nursing homes. Actually, it was run by our professor of medical microbiology, Alex Friedrich. This one runs already for many years, and actually you can also see that it's successful. So MRSA infections goes down in this region, because it's much higher in Germany than the Netherlands, so they can learn from each other. So this is actually healthy aging for the entire region. And these are the programs we also fit. And this is actually a program in which also local enterprises are involved. And so there's also jobs for people. So this is a very nice one. And then another one is, for instance, this runs together with our Laboratory of Pediatrics, and also with Danone Research, which is a very big dairy food company in Europe. And this is about healthy nutrition early in life, so nutrition for the mothers and for the babies. So they call it the first 1,000 days, so it's the pregnancy plus the first 2 years, 1,000 years of how you have to optimally. And so this is part basic science, how does it work, but also application. And this actually is interesting that we use this big cohort study, because there's a lot of young women involved, and they now get babies. So we'll also follow the babies, 1,500 newborns, from lifelines will be followed very carefully, development of the microbiome, all these issues related to the nutrition. So this is another program that fits in this thing. And again, I could talk for hours, which I usually do, but not today. But these are the programs we're running. And then the important thing, of course, is the environment, the housing. And that's where Dr. Wood and also Barb were in Groningen last year. We had a very large international conference. Actually, it was one of the, because Netherlands was the chair of the EU in 2016, so this was one of the meetings, Building the Future of Health. And this was actually on topics of architecture, urban design, spatial planning, transport, policy making, and the citizen, to really come to a healthy environment. And this we link to this earthquake stuff. And that's why we were in Appingedam, because this is one of the cities where it's happening. And during this meeting, where Dr. Wood told about the Mayo experience, and Peter Scalia was there, we actually signed a MOU with the major partners. So the national coordinator is the guy who spends the money, economic board has the economic money. And this was summer of last year. And usually when you sign a paper, as a dean I can say that, you sign a paper and then you go home and you say, well, that was it. But there's really action now, so that's really important, because there's now action going with 5 initiatives from the citizens. So this really comes from the people that do the things. So there's Garmerwolde, these are small villages that are hurt by the earthquakes, and they all have their own solution that they want to realize in the coming years. And there again, it's very nice to have the experience also of Delos and involved at some point. But this is really done by the question comes from the people. These are the people who have to do it. So there's building companies, there's tech, Philips is involved, care is at home, Vital at Home, health insurance even involved. So we will now realize, at least on these 5 spots, and then try to expand, of course, this next thing. And again, see that Groningen people are very direct. You don't want to be a part of the solution, you are part of the problem. So it's you have to collaborate, so to say, otherwise you are part of the problem, so to say. So this is what's happening now. So not yet for all. So this is a picture from Lifelines that we put on our screen. So this is obesity. You can see close to the border. This is not genetics. This is pure socioeconomic status. So we say we are a testbed for Europe. Actually, Europe acknowledged that we are a testbed. One of the things, actually, I didn't say yet, because we have compensation, part of the money will be invested in a 5G network in the northern part of the Netherlands by the Economic Board. And because of that, we are of course very well equipped to test all the innovations with e-health. So now we already see the big companies coming to the northern part of the Netherlands to test their applications. So this is what we are, and we are on our way to become the first man-made blue zone. And finally, these are the people who do a lot of work. Josien has been here a couple of times. Our healthy aging team, Dan Bultje, who is director of the Han network. This guy does an amazing job. Inge Zwerver, who's from the villages in Groningen, and of course the Nobel Foundation, through philanthropy, they support this action. So I hope I'm still in time. Okay. And open for questions. Thank you.
We'll have some microphones that are coming through the audience. Are there any specific questions for Folkert about what he's covered? Fran?
Thank you, Dr. Wood. I'm really curious how the children in primary education are receiving the health education that you mentioned you're delivering to them. Are they embracing it? Do they understand it? Do you see change already in them?
Well, there's different programs running at the moment for different age groups. I think they do understand because there's special programs made for it, dedicated programs. The question how to work out, we have to see, of course. So in the end, if the children know, that's fine, but in the end, of course, the parents have to know and understand also. So far, what I understand, because it's not my thing, the schools are enthusiastic. That's one important point, because they have to do it partly in addition to the things they already are doing. So it's more work for the teachers. But we try to implement it also in the teaching program. So for instance, you saw these kids practicing. Actually, our Department of Movement Sciences they developed a program in which they combine learning with movement. So they learn also, they do countings, and then at the same time they are doing all kinds of exercises. So it's actually a two-edged sword how they do it. Again, the success we don't know yet. But at least they are enthusiastic, so that's a good thing.
Any other quick questions, Barb?
Thanks so much for the great presentation. I'm very interested when you mention how important it is to try to look at the societal impact from the research. Have you made fundamental shifts in how you're approaching research in terms of understanding needs of people you're trying to serve so we can move the research process along more quickly? We think about the United States and how long it takes in laboratories and things to try to get to that impact to people. Right. And along with that, what advice you might have for us in the United States to move it along more quickly?
Right. I think the main thing here is that, at least that's how I organized it, is that the scientists should be scientists. And I think that people who try to translate science to translation should not be the same people. So that's why I developed this Center of Development Innovation. There's a couple of people who come from industry actually, and they have a couple of trainees with them, and actually they go scouting. And they actually will talk to the scientists for the basic, and this goes for the basic scientists. And again, addition, we have at the medical center, of course, a lot of more applied kind of science. And these people usually have more ideas by themselves, and they are helped by the center. And so they usually, if they develop a new bed or a new app for something, they know how to find them, because we do a lot of advertisement for our Center of Development Innovation. So everybody who finds something, they will know how to find these people. And they help them. Because in the end, I think scientists, well, especially basic scientists, well, they are scientists for a reason. Because they are very curious people and they want to find out how it works. But they are usually not the most smart people to go how to translate this to real application. So you need different people for that. So that's why you made a chain within the UMCG, and that works pretty well.
Good afternoon. I'm Jonathan Fielding from UCLA.
Hi.
With you on the panel looking at this afternoon. 3 quick questions. One, how is the immigrant picture perhaps affecting how you view the opportunities and some of the threats to achieving the blue zone? Secondly, how much concern is there broadly, not perhaps in Groningen because of where you are, but how much concern is there about the water level rising as a long-term major threat? And I mean, I'll just keep it those 2 questions.
Well, the immigrant issue is, in the Netherlands, an issue, of course. For some reason, there's large regional differences in the Netherlands, how they perceive the issue as a problem. For some reason, the northern part of the Netherlands is rather a hospital region also for refugees. I think it's also historical reasons. So we do have quite a lot of people from Syria. Perhaps partly through our awareness of things that we have, I don't know exactly how to put it, but we realize that we need young people to do work that we don't have sufficient people for. So actually there's a large acceptance of immigrants, of refugees, because we realize they are there for a reason, and they are not there for fun, they are there for a reason. Of course there are bad characters between, so that's always the case, and they of course spoil the issue for other people. But I think in the Netherlands, in the northern part of the Netherlands, it's rather well taken, and it does not interfere with our program so far. Actually, I truly believe that we need these people for care tasks and all these issues. So that's not a... The other question again?
The other one was the rising water level.
For Netherlands, yeah, that's an issue for us, because actually my house is just above sea level, but most of, because there's some little hill. We are increasing our dikes currently very, very strongly. It's of course the climate is a big issue in the Netherlands. So especially the Green Party increased again in the Netherlands now, partly for this reason, because people are concerned. I think Dutch are pretty good at water, so we don't worry that much, but we did elevate our dikes already quite substantially. But yeah.
Nathan, could I invite you to join us? I'd like to introduce to those of you who don't know him, Dr. Nathan Labrasser. We were talking earlier about the highbrow French way to say that name, which is what I would have thought when I looked at it, Labrasser. Nathan, for those of you, again, who don't know him, has worked with us in the Center for Innovation as the director of the Healthy Aging and Independent Living Laboratory. He has a lot of other responsibilities in the Koga Center for Aging, as well as clinical and other research responsibilities. It might take me 10 minutes to describe all of them, but I'm glad you could join us. Why don't we have a seat and start a conversation. This morning in the Center for Innovation, we were talking about some of the research that Folkert and his colleagues have been doing, and it came to us fairly quickly that language is probably important, and I was intrigued that when you were thinking about what's the right name for the activities, you quickly avoided the concept of chronic disease.
Right.
And focused on something else. And to us in the Center for Innovation, it's really important. We think of our mission as really transforming the way that people experience health, not chronic disease. But in the U.S., we tend to focus a lot on disease. So what's there in language, Nathan, that makes a difference? And would we make more progress if we focused more on truly aging as natural biology than we do focusing on chronic disease?
Yeah, that's a great question. There's a lot of different elements to that question. One is this concept of ageism and how our language influences how we interact with and interact with older individuals and think about interventions for older persons. I think the other element of healthy aging versus chronic disease emphasizes a point that Folkert really nicely highlighted, and that's aging is a lifelong process. This is not something that we wake up one morning and we're 65 years old and now we're old, right? This is something that
Thanks,
really,
I feel better already.
Right. So the notion that, pre-conception aging programs are already in place and underway, and early life choices so strongly influence that underlying biology that many of us are studying that ultimately lead to the overt manifestation of disability and disease in later life. That's a really important point, and I think discussing aging with the language that showcases the fact that this isn't something to worry about when we get much older will bring more attention to the issue and create greater interest.
Folkert, you've given us a sense of where you think about this already, but would you like to continue?
No, I really think, and the other thing is indeed, and that was in the beginning in the Netherlands very strongly, that in Groningen they try to make us live very long and become 150 or something. That's not the issue, and we have to keep on emphasizing it. It's about the health span. It's not the lifespan, it's the health span that we worry about, or that we're working on, that we want to prolong.
Well, so I thought that was really an intriguing concept as well. So, and then Nathan, I know you've been actually thinking about this concept of health span and actually do a lot of work in it. But it's kind of intriguing to me that in the United States, anyway, we seem to focus always on the concept of lifespan in years and make comparisons about lifespan in years. And in fact, in clinical trials of disease-based things, it's always the survival and the lifespan and not the functional capacity. And in the Center for Innovation, we've been trying to emphasize for a number of years that in the U.S., we're measuring the wrong things because we measure survival, and we should measure health as role functioning, right, using a different set of measures. So obviously from the experience that both of you have, there's some science here that says it's time for us to change our language and start thinking more about health and role functioning and what that really means. Right. So my experience is that clinicians tend to look at that as being not a very good measure because it's what they call a soft endpoint. How should we change that? Or how best do we go at that?
Actually, it's not only us, it's actually also the WHO who defines health not as the absence of disease, but as a ability to cope with the situation, with your life. It's not purely disease oriented. It's the ability. It's also the resistance. So health is not only not having a disease, and actually WHO already uses this definition. So actually, doctors should listen to the WHO, I would say. But this is something that, of course, is a concept in your head. I'm not a medical doctor myself, so I don't treat patients. But I can imagine if you are a medical doctor, you want to cure somebody who's sick. That's your job, so to say. But I think as a medical care or health professional, like we could also call it a health professional, you should actually care more, perhaps, about people not getting sick. And that's something we try also in our curriculum to teach our students, that they should look more from this perspective. And that's why we also changed the curriculum to a certain extent, also to get more involvement, for instance, of nutrition, or the concept of exercise as a preventive measure to become disease. But also around disease, because we are now I'm pretty sure also here, about treating cancer patients before chemotherapy with exercise and with diet, and to improve outcome. So this is a little bit change of concept, I think, that should occur.
What do you think, Dave?
Yeah, I would just add that I think the advances in care for individuals with many different conditions, we're seeing a lot of the specialists now come to us and say, what really matters here? So our patients are surviving for 5 years, but this concept of patient-reported outcomes is really permeating many different disciplines at our institution. I'd like to think that we're unique and we're leading the curve in this space, We just did a very lovely study with cardiology where we looked at patient-reported outcomes, everything from physical and mental health, but also spirituality, social interactions, and how those deemed frail prior to surgery fared in response to this intervention. And we realized frailty or the lack of resilience predisposes you to many complications of surgery, which our surgeons care about and our healthcare practitioners care about. But do these people actually get better from an invasive intervention? Is it worth it? You know, it's kind of we used to jokingly call it the wee-wee test. Was it worth it, right? Mm. And we're learning a lot about how people who are deemed frail or are at risk for bad outcomes actually benefit in many different ways, not just their physical health if you fix a problem, but all of a sudden their social connectedness improves, their spirituality improves, their mental health improves. And that's a really important and big statement, and it also reflects the need to look at other outcomes than just survival. In patients in whom we're doing very invasive and sometimes high-risk procedures.
So we invite questions from the audience as well. So as we think about other aspects of healthy aging, please raise your hand and ask for a microphone. We'd love to have your contributions to the conversation as well. While we're looking, as you're thinking, raise your hand. You have to raise it high for some of us to see it down here. While we're on the way, I'm going to ask Folkert another one. You said you're not a clinician and don't see patients, but in this concept of thinking about the measures, as a researcher, should we just start regularly asking people a standard set of measures about their role functioning?
I would really think that would be a good idea, actually, because I think it would be extremely informative. Well, I'm in pediatrics, of course, and there's an additional layer of complexity how to ask a child about his or her feeling of well-being. But I think that, and I noticed that you're in your Center for Innovation are already well busy with this pain score for children. I think these kind of things they are really crucial for let's say a new kind of medicine, so to say.
Please go ahead.
So thank you, Folkert. It's always a great chance to listen to you and hear what you have to say and the new things, the latest things you've been talking about. And you know the giant soft spot I have for Groningen, of course, as well. But my question, I guess, pertains more to seeing also Nathan up there about the concept of exercise and just in terms of activity. If you go to the Netherlands, you basically almost get run over by bicycles everywhere you go. And I think most Dutch people probably have 3 or 4 bicycles each. And my question is when you see this kind of decline in health with advancing age, or I would tend to think that people in their midlife are much more active in the Netherlands than they are here. And often when we're talking about interventions that are really the most beneficial are exercise interventions or things like that. And so I guess mostly my question is that something that really changes with age in the Dutch population, that when they become advanced, they just don't do those kinds of activities? Or is that maintained in terms of they still are continuously active? Because then I think that kind of goes against some of the concepts I think that Nathan would really advocate for, of just getting out and doing something and being active.
No, I think so. Where you were in the city of Groningen, which is a very young city and with a lot of students. And indeed, they bike you over, so to say. They don't never stop. But if you go to other regions, I think it's a different picture. And there's much less activity. In the red zone I showed you in the eastern part, these people are much less active. So that's why I say, even in a relatively small region like northern part of the Netherlands, we already see from lifelines there's huge differences in disease prevalence. Part of that is socioeconomic, but it's related to exercise, but also food patterns. Even between the provinces, you can see that there's differences in food patterns. So I think you're overrating the activity in the Netherlands. It's special groups.
I guess I didn't really see very many obese people in times that I've always been there, but I've also
again, you are in
not been in the,
you are in the city of Groningen. The city of Groningen, it's a very young city, indeed. But if you go 20 kilometers to the east, you will have a different picture.
Other questions? So, Nick.
So this is a question a lot of people ask. If you read Blue Zones, you can identify 3 behavioral things that make a difference. exercise, diet, and societal connections. But there's also genetic components and maybe even epigenetic components. Do either of you want to speculate on the relative importance of genetic/epigenetic features versus the things that we can control? I guess to an extent we can control epigenetics because that's related to what we eat and et cetera. But you want to either of you want to comment on that?
I fully agree that well, the three topics you mentioned, that's really the most important ones. I do think genetics itself, for instance, in lifelines, we did all the genetic stuff, and there's no genetic reason for this difference. But it may be epigenetics, because, well, usually what I tend to say, if you're born in the East, you're already 2-0 behind, because you probably have an obese father and obese mother, so you're already 2-0 behind before you're born. And then and that's what we do in the study I mentioned on early nutrition. You do see a lot of epigenetic changes, and that actually go over generations. And so it's very difficult to, well, we put a chance to get a blue zone, but that will be very difficult to reach, let's say, in my lifetime, because if these epigenetic goes over generations, it will take quite a lot of years to wash out, so to say.
Yeah, I would just add that the concept of blue zones and these 9 traits that underlie these blue zones is fascinating. And it's also humbling because it highlights how complex the recipe to healthy aging is. It also kind of showcases that, maybe 10 or 20% of our lifespan is dictated by our genes. But it makes me think also of the fact that if you have a genetic predisposition to a disease, you don't necessarily get the disease. If you don't have the genetic predisposition to a disease, you might get the disease. So there's some, very fascinating interaction between these different behaviors, these different environmental exposures, these different life circumstances that all interact together. And as much as we kind of trivialize genetics, maybe it's really an important player when we mix that into the equation with all these other factors that lead to healthy blue zones.
Yes, ma'am.
For Dr. Kuipers, you mentioned that one of the focal areas of research was energy and transfer of energy, and could you explain a little more about that?
You mean in the University of Groningen?
Yes, in the university.
Yeah. So what we do, the program is on energy transition. So we do have, of course, there's a lot of energy-related business in Groningen, and natural gas, but also there's a lot of big energy companies in the northern part of the Netherlands. And they all realize that we have to go to a more sustainable manner. Even the companies themselves, they realize that they have to change. So actually what they did in conjunction with the University of Groningen, they created the European Academy for Energy Research, something like that. Beautiful name. And so what they want is to go from let's say, from the traditional energy sources, so the gas, the oil, to more sustainable. So in northern part of the Netherlands, there's a lot of knowledge and also interest in wind energy. So we have these large wind parks in the country, but also in the sea. And there's a lot of interest and also a lot of knowledge and also a lot of activity in the solar energy. So these are the most important things. So in northern part of the Netherlands, there's not a lot of tides, so that would be in other parts of the world you could use the tides. But for us, it's especially the wind energy and the solar energy that's developing very fast.
Up here. Yeah, hi. So I have a question for Dr. Kuipers. So I was observing, and for example, some of the countries like Asian countries, like Japan, where the lifespan was longer. But the lifespan is still longer, but the health span is getting shorter and shorter, probably included they have some diseases. Do you think that infiltration of fast food and changing food habits are affecting the place that you were talking about?
Yeah, that's actually has been documented for the blue zone here, Okinawa, which was actually a blue zone. And one of the things that was the cause of this blue zone was the fact that there's the habit that people don't finish their plates. And so they always leave a certain amount of food behind. But of course, with the introduction of fast food change, which is some kind of colonialism from this side, this feeding behavior, this behavior has changed in the way that people now eat more fast food and don't use this stopping before you finish practice anymore. So there you actually see rapid increase in overweight and obesity-related diseases. That's true. So actually that blue zone is now turning red also.
So we've gone a little bit past the hour, and I know that there are people who have other things they need to do, judging from the early departures. But before all of you leave, I want to remind you that the next in the series of Unexpected Conversations will be May 9th, and we will be welcoming to the conversation Elizabeth Rosenthal, who has been for the last 20 years a senior writer and reporter for the New York Times, and currently is the editor-in-chief for Kaiser Health News. She will be here to talk about some exciting aspects of her work, and I will tell you that she will be the moderator for Transform this year. So keep that on your calendar, or put it on your calendar and join us then. I want to thank Nathan for joining us today and adding your perspective, and Folkert, a warm thanks for your great contributions to this conversation, as well as spending time with us in the Center for Innovation and joining us on the Scientific Advisory Board for the Well Living Laboratory. And let's all thank Folkert and Nathan especially for their contributions this afternoon.